then, Richard, aren't you? So we'll leave you to turn that on. I just really therefore want to move on to, so the second item on our agenda is declarations of interest. Now, normally this is the opportunity for people to indicate if there's some potential, something on the agenda that they might have a particular, not interest as in I like the sound of that, but there might be a potential conflict or something where you have some involvement in that particular issue. For new governors, you'll be asked to complete a conflict of interest form, and you will have probably received that from Tracy already. But has anyone got any declarations of interest for items on the agenda? No, okay, excellent. Brilliant. So we're moving on then to item 3. Item 3 on our agenda is the governor member update. So this is really just a brief opportunity. I'm just going to invite Tracy, who I hope has got something that she's going to share, yes, which really just shows us who's joined, who's left, and so that we've got a sense of the changes to the council. We're not going to go through it in detail, but at least it gives everyone a picture of the changes that have occurred, because obviously this is a very fresh new council and we just wanted to highlight that. So Tracy, over to you.
I think Richard's going to help me sharing these slides, only because I can't see the screen if I share the slides. So Richard's helping me with this one. So I'll
hopefully everybody can see the slides now.
Yes, we can. Thanks, Richard.
So the first slide should show all the new governors. So do you want me to read them out, Christy?
No, I don't think. Just pause for a moment. So I think it just shows the names of new governors and the actual constituency they cover. So a warm welcome. Is that all the new governors, Tracy, or is there another?
13 new governors.
Okay. And can you just, are you able to confirm that all of those governors are with us? So we already know Krishna isn't with us today.
Yeah, so the only person who hasn't joined yet is Pat, I believe, who is joining. And I'm not sure if Evie's online just yet.
But she was intending to. So yeah, welcome all those new governors. As I say, I think we've already noted Krishna's apologies. Do you want to move on to the next slide? Sorry, Chris.
I'm really sorry to interrupt the flow. I've just had a text message from Zoe to say she can't access the meeting. She's using the right link, but a problem with password. If Nikki Hitchcock is on the call, could she give her a ring, please? Okay. Do you have her number? I can send it in the chat if that's possible.
Yes. I was going to say, sorry, Chris, don't put it in the chat just because it's data protection issues. So it's governance. If you perhaps send it to me, and then I'll make sure that he gets it.
Okay, thank you. Sorry to interrupt.
Thanks, Chris. Okay, Tracy.
Yeah, so we've just also listed all the governors who have left sort of post-elections, and anyone that's recently left as well.
So I think there's for a mixture of things. Some naturally terms came to an end and they weren't able to stand again. Some have resigned, and some are governors who chose not to stand again. So it's just a mixture of changes that in terms of governors no longer in post. And is there a final slide?
Yeah, the final slide just therefore summarises the current vacancies, sort of taking all that into account.
Okay, and just to highlight to everybody that so when you see the public seats and the service user and staff seats, those are elected governor seats, and the partner governor seat that's vacant is actually an appointed governor. And we'll be talking shortly about elections and actions to take that forward. So we'll pick that up separately. Tracy, is that okay?
It is, yeah.
That's everything you wanted to say. So again, a warm welcome to all our new governors, and please don't hesitate. We'll try, if we're using any sort of abbreviations that people are not familiar with, we'll try and cover those in the chat. So look out for that. and do feel free to ask any questions as you need to. Chris?
Yeah, just if I may, Krishni, just can everyone hear me okay?
Yeah, we can.
Just to extend a welcome as Acting Lead Governor to all the new governors on the call today and to those that have continued with their service as a governor. And just to really reiterate what Krishni said, this is your first meeting. Please don't think any question is not too silly to ask. You know, we're all on a lifelong journey here. And if there is anything that you don't quite understand, we don't want you to go away thinking, I wish I'd asked that. You know, please feel free to say anything that you don't understand or need to clarify. But it was good to meet the new governors last week on the 2 induction sessions. So thanks for your time. Thanks for coming along today, and look forward to getting to know you better. Thank you.
Thanks, Chris. So we're now moving on to look at the minutes of the meeting. Now, I do appreciate that for new governors, the minutes of our last meeting, they would have not been present for. So I'm particularly looking at our more perhaps experienced governors like Helen and Chris, to just confirm, and Paul indeed, and Rosie and others, to just confirm whether they're happy, first and foremost, whether the minutes of our meeting of the 11th of March are indeed accurate. So could anyone got any points of accuracy to raise with me? I'll pause for a moment if anyone wants to raise anything, but otherwise I'll take it as that you are happy to approve those minutes. Okay, everyone seems okay with that. So the minutes of our last meeting are approved. What we then have is the action points. So that's paper C. And what you'll see on paper C is the items that were open from the last meeting. And you'll see that the items marked in yellow are now proposed for closure. So the first item was the first item on that list is actually going to be covered today because it relates to the local authority changes. So we've got that on the agenda. So we're proposing that for closure. And we've also got a couple of other items relating to Zoe, I think, wanted us to do some join one of our meetings, and I think that was proposed for closure because that action was taken. And I also am aware that David picked up the action regarding NHFT representation on the VCSE group, the Voluntary and Community Services Assembly action. So if everyone's content, I'm proposing those for closure. Chris?
Yes, if I may, Krishni, thank you. I'm just going to minute reference COG 2120J. It's on the action log as number 24, Reforming the Mental Health Act. And this is as much for new governors. And the action doesn't necessarily do justice to the process we adopted. And I'd like to add a bit of colour, bring this agenda item to life, if I may. One of our functions as a council and as governors is to express views on the Trust's future strategic plans, and in this case, national policy direction. In and of itself, this was a good example of how the COG can operate, particularly on this issue around reforming the Mental Health Act. And I didn't want the moment to pass without saying thank you to Paul Kelly and Fiona Judge, who, as our carer governors, invested some deal of time, energy and expertise, but also brought their perspectives as carer governors into this process, which resulted in us as a council submitting written comments and feedback into this important consultation exercise. And linking it to the briefing session, we also proposed that as an integrated community and mental health services trust, we as governors, both individually and collectively, should be more familiar with the provisions of the Mental Health act doesn't mean we have to be experts, but it is part of our core business. And to that extent, you can see there's an action there that we arrange a briefing session later in the year to familiarise ourselves with it. But please, as particularly for new governors, this was a really good example of how, as governors, we can bring our, in some cases, lived experience, our expertise, our knowledge to bear on an important consultation exercise. So I'm grateful particularly to Paul and Fiona for their contribution into this process. Thank you.
Thank you, Chris. That's a really helpful refresher of that item. So that bit of the action was closed, and the bit that's outstanding is the agreement that we had that we should do a briefing, which probably best is organised when I think the government in the Queen's speech is highlighting its intention to change the Mental Health Act or reform the Mental Health Act, and it's probably a good time when we know more about those changes to bring you all together to do a special briefing on that. So that's the plan, and that's why we've left it open on the agenda. I can see that Susan Bruce would like to come in. Susan?
I would just like to say I do have a lived experience within mental health. I'm a peer support worker at St Andrews, so I would like to be involved in that, but you said it was closed. Is there any chance that I could get the paperwork or see what's been written up or done?
I'm sure that the feedback that the council or Fiona and Paul actually provided on the Mental Health Act can be shared with you. That consultation is now closed, Susan, so that happened obviously before you joined us as a governor. But we can absolutely share that with you, but unfortunately because the consultation is closed there won't be an opportunity to add anything else at this stage, but I'm sure we will be revisiting that and talking about it, so it'd be great to hear about your experience more when we discuss it again. Is that okay?
Yeah, that's fine, thank you.
Lovely. And can we just take an action just to make sure Susan receives a copy of that consultation? Lovely. So is everyone happy to close those yellow marked actions for now? The blue ones were already closed from last time and the white one will remain open. So that's just a kind of quick roundup on the actions. Everyone okay with that? Great. I'll assume that's the case. Yeah, good. An occasional thumbs up would be helpful, just so I know, so I know everyone's okay. That would be good. Great. Okay, so I think we've covered all the outstanding points on actions and our sort of general opening section of our Council of Governors meeting. That's pretty much standard that we go through all of those things as normal, but we're moving on now to session 1, and there's a whole load of different items here that people will take you through. I think predominantly it's going to be a combination of Fiona Barr, our Director of Corporate Governance, Chris Davison, who you've already met, who's our acting lead governor, and then later on Carol Phillips, who's our acting chair of our Nominations and Remuneration Committee. So I'm going to start with item 6. So I'm not sure who's kicking off. Fiona, is it over to you and you first?
It's over to me and then over to Chris. So welcome everybody. It's great to see all these new faces. I'm Fiona Barr. I'm the Director of Corporate Governance, and you'll be coming into contact with me and my team an awful lot in your journey as governors, and we are very much here to help and support you, particularly the new governors where it might all be a bit new to you. So what is presented at item 6 is really a summary of what we did last year. Last year was a really important transitional year for us as a council, and we are required to put some information in our annual report and accounts. This is an important legal document that we have to produce as an NHS organisation. All NHS organisations have to produce them, and there's some information that we particularly need to put in. But I thought we would use this as an opportunity this year to really reflect on what we did last year and how we changed things, because the pandemic made us change things really, and it really helped us identify new ways of working, which when we look at item 7, we're suggesting that we actually carry forward some of that new practice, that best practice that we've actually developed. So I, as well as having council and governor meeting today, I'm also responsible for actually the annual report and accounts, the whole document. So I've been one of the things I need to do after today's meeting is finalise all of the input for this. So if you do have anything that you want to add to it, please can you let me know by email or just leave me a little message in the chat and I will get back in touch with you. But really, it's presented for your input. Chris Davison has kindly had taken a look at it, and we've used information that we've got from our governor sessions previously. But I'm just going to hand over to Chris because I know there was a couple of things that he particularly wanted to make sure that we reflected in there. So Chris, over to you.
Yes, thank you, Fiona, and thank you too for all your hard work in producing the annual report and accounts. In a previous life, I had to do that, and it's like a dissertation. So thank you to you and the team for everything that's going in. And within that spirit, I've got a few things to raise, because I suppose, as from my perspective, in terms of we've got, if you like, we're looking back, but it will link in to how we look forward, which is the next agenda item. For me, any comments I make now are looking to strengthen the narrative, to strengthen the commentary. And one thing I would like to suggest is that we do need to make reference to the 3 workshops that I facilitated with Richard and others around membership, engagement and representation. In terms of the journey we have had as a council, I think they were quite key. We had 3 workshops, 20 governors, 175 items of feedback, comment and suggestion in terms of how we shape and fulfill our role in representing members in the community. So I'd like that to be weaved in, if I may. And equally, the reference to the PPI strategy, rather than saying it is merged, I think everyone on this call would agree that one of the golden threads running through NHFT is that we co-produce or co-create. And in recognition of governors, both past and present, I think it would be good to say co-produce PPI strategy. And I think in terms of the opening, so there's an opening comment about reasons we stood the subgroups down. And I think it's really important that we make reference to the fact that we were in a pandemic. We're in a level 5 major incident, and one of the reasons it was stood down was the reducing the burden guidance that came from the Department of Health. So there's a couple of areas I just want to strengthen the narrative, perhaps reinforce, and I'll drop you an email, Fiona, to sort of expand a little bit on that, and possibly also some of the, perhaps we could have a bit less management jargon. And I offer that as a previous NHS manager, in the sense that the annual report has so many different audiences. We as governors are volunteers, and it would be nice to get a flavour and sense of how we operate, but in a tone that is perhaps less, and please, no disrespect, less management jargon focused, if I may.
Thanks, Chris, and very happy to weave those items in. I also think we might want to make a reference to the 3 words that guided us at the beginning of the pandemic.
Yes, very much. Thank you. Yeah.
Where we had a really, really strong focus on how we transact, how we communicate, and how we support each other. I need to manage your expectations, though, Chris.
I know.
It's 11th hour. There's a limit in terms of what I can do in terms of changing the editorial tone, and we also need to make sure that the editorial tone is consistent with that of the annual report more generally. But let us take that as a learning for next year, and we really have tried to actually make it a bit more accessible and user friendly. I just wondered if there was anything else from any other governors, existing governors, governors that have been through 2021 with us, if there's anything else that you felt that we'd missed or that we should add, or anything else. As I say, I don't want to spend too long on this item just because I know time is against us. But if there's anything else, please can you indicate or either now or I see Helen's actually got her hand up. So Helen, please.
I always put my hand up, don't I? So just a couple of things from me. Just for any new governors, I'm Public Governor Northampton, if anybody needs to know where I'm located. So page 7 is a factual correction in the table for the attendance at meetings. So you've got me in as from 24th of April 2021, but it was actually 2020. So just adjust that by a year. Thank you very much.
Just spotted there's a couple of 2021, so we're obviously a year ahead of ourselves. So we'll correct that. Thank you.
Thank you. Echoing Chris's comments, I think it's really good to bring all of this information together and to give people a well-rounded flavour of what we were doing. But yes, it would be, I think we could make it shorter. I think we could summarise it a little bit more and possibly do a few less of the organisational words, because it is about our actions as volunteers, although we're working within a constitutional framework. So I think there's an opportunity to go shorter if you've got the time.
Thanks, Helen. We probably won't have the time for this year, but I mean, if I'm sensing that people really like this, and so let's build it into our calendar for next year and actually kind of start work on it and get the editorial tone and so on it and the ideas for it a little bit earlier. So let's take that as an action, if that's agreed.
And I think, Fiona, I think that sounds like a good plan, Fiona. Bear in mind, of course, that this is actually a formal document that goes into our annual report, but actually we have an opportunity to present the work of the council at our AGM, our annual general meeting, and that is an opportunity to put it very much in the words of council, and shape it in a way that particularly council would really want to do. So we've got another opportunity to do this when we organise our AGM annual public meeting, and that's perhaps the really good, the really positive opportunity to bring the work of the council to life. There is just another factual correction, Fiona. I noticed Neil Goosey doesn't appear to have any data for attendance, and we know that Neil was definitely present, so that's just a fact. So we probably just might have just got lost in the Excel spreadsheet.
Exactly. We'll double check all that attendance information. So apologies for that. Yeah.
Okay. And actually, I couldn't see that Neil had joined us today, Tracy. So I just mentioned that.
He's definitely online, I'm pretty sure.
Okay, fine. Okay, that's great. Oh, he's there. And he was going to raise that point, but yeah, I didn't want Neil's contribution to have been missed from last year. So I think some really good feedback. Thank you very much, Helen and Chris. I think it's a sort of a good development from last year. So I think, but clearly there's some further opportunities for refining based on the feedback that we've got. And I think Fiona's committed to try and start that process a little bit earlier, so we can perhaps run it by council members before it's sort of so close to publication. I think we are very close to having to sign off the annual report, aren't we, Fiona? So hence the time constraints, and that's a statutory requirement which obviously we have to fulfil. Okay, does that cover that item, Fiona? Are we okay to move on?
Absolutely, thank you.
Excellent. So the next item, I believe, is also back to you and Chris, Fiona. So item 7.
That's absolutely correct, and I hope that we have got some slides to show. So I just wonder if Richard is able to show that second presentation that I sent through this morning, please.
And just whilst that's happening, really this is the sort of next step from the previous report. That report is looking back on last year. This is sort of looking at, how do we build on that really and take some of that forward. So over to you, Fiona.
Great, thank you. So Chris is largely sort of taken my introduction from me. That is exactly what we were seeking to do. I mean, really, we want to capitalise on the best practice, the new learning that we had last year, some of the features of last year's calendar. We want to move forward, but we're also mindful that we've got some new people joining us. So we need to be flexible, and we need to ensure that we're listening to our new governors as well. So I'm largely going to hand over to Chris now. It's going to be a bit of a double header, but more Chris than me. And we've got some questions that we're going to come back to at the end. So we'll be posing them through the slides. I mean, there's only literally 4 or 5 slides, but we'll come back at the end so we can actually formally kind of ask you those questions so we can take things forward. So Richard, can we have the next slide, please? Okay, Chris, over to you.
Sorry, just put 10p in the meter. Can I just check how long we have on this agenda item, please, just for the benefit of the meeting?
We've probably got about 15 minutes, Chris, 15, 20 minutes, no more than that.
Okay, well, I'm going to talk through the slides for hopefully 5 minutes or so. And as Fiona says, we'll have time at the end to respond and discuss some of the questions. So in terms of the journey that we have been on, we started last year in the middle of, at the start of the pandemic, quite rightly saying, how do we transact business? How do we communicate? How do we support each other? And we've entered in a new way of working. We've got to think about our Council of Governors meetings, which, as you've heard at induction, there's 6 a year, and predominantly they're during the day. But we may need to think about how we time these to work around people's work commitments, family, personal situations, and perhaps we should vary the times. We've also seen a commitment from the Trust to what they call a keep in touch briefing, usually after every Trust Board meeting. As we can't meet in person, this enables governors to receive feedback on issues that are covered at the board, and also topic-based briefings on specific issues. So, for example, I've already talked about the Reforming the Mental Health Act. There's potentially one around the future of integrated care systems, the role of a governor in that process, and how the public voice is heard. We also have a very successful virtual coffee morning. Now that sounds a little bit strange, but actually it's an informal meeting. It's an informal setting to allow us to get to know the non-executive directors a bit more as people and us as people. One thing that draws us all together, one thing that we share, is our commitment to public service, our commitment to our constituencies, our community, and the people we serve. And the coffee mornings, and I'm very grateful to Maria Wogan, non-executive director and vice chair, that together we've held those, and we've really found it an opportunity to connect. And from that connection, we can build trust and confidence, which is important underpinning principle for our new foundation. Theme-based workshops is also something we want to explore. As I mentioned earlier, whether it's a specific briefing or a particular workshop. And the 3 workshops we held last year, and that was a real team effort, grateful to Richard Smith in the FT office, that proved really valuable when we opened it up to a much more wider discussion to allow governors to input. So thank you. Next slide, please. Training and development. Now, again, we have had a situation where we have mandatory training. Although we are not members of staff, we do need to complete a basic level of training, whether that be health and safety, equality and diversity inclusion, fire safety. But I think we need to take this on a level. I want us as governors to be the best that we can be. And in order to do that, we need to think about how we deliver our training. NHS providers offer the Govern Well courses. They're very credible, well respected. We did a joint session with KGH governors a couple of years ago, possibly longer, around basic introduction for governors. And perhaps we can build on that, looking at in-house and external training, and not just about basic skills, but also about development. How do we manage that space between us? How do we hold to account, but also represent the community? How do we keep one foot in the trust and one foot in the community? So again, that's something we're looking to refresh, and the potential to look at our needs as governors. Next slide, please. Now, membership, and this is, I'm going to go a little bit deeper on this one. One of the key issues coming out of the 3 workshops we held last year is that we need the trust and ourselves to work together to engage with members in a more meaningful and intentional way. At present, they receive periodic emails, a couple of bulletins a year. And I think there's a recognition from the trust that we need to strengthen that offer. And the potential option that came out of that was to create a dedicated governor and members office. Whilst we have a membership database, and forgive me if this sounds a little challenging, it is actually a list of emails and addresses. We need to go further and deeper. If I wanted to know how many members in Kettering and Corby, Zoe and I could then target, perhaps who came from different ethnic minorities, I don't think we could do that. So we need to refresh our membership database to a point where it is in a usable framework that we can operate in. There is a recognition from the trust that we need to reinvigorate our membership activity. I was so pleased that back in January, working together, we had that Blue Monday event. And that really did not just signpost members to NHFT services, but also other services available in the community. It is aligned with our PPI strategy. And just to refresh new governor's memory, before the pandemic, November 2019, the council adopted 3 key principles, 3 key topics, 3 key areas, priorities, whatever you want to call them, to support our membership activity and PPI strategy. Those 3 areas were equality, diversity and inclusion, children and young people, and adults of a working age, underpinned by improving capacity and capability within PPI. Now, we need to refresh that in the year ahead, potentially having an editorial board so that the newsletter that goes out is much more owned, or should I say, contributed by governors. Look at topic developments. There's areas we can be subject matter experts. For, again, going back to the Mental Health Act consultation, it was brilliant. So we need to look at all of those issues, stronger focus and showcase on governor activity, resource to support membership. And one option to do that is to create a membership and representation group to coordinate this, which would be made up of governors, trust staff, and we could look at that. And that's one of the questions at the end. Final slide, please.
Just before we move on to that slide, Chris, if
yep.
I just mentioned part of why we put that governor involvement as subject matter experts, it's really to just emphasise the point that Chris is making. So Susan helpfully mentioned at the beginning of the meeting that she's got lived experience and that she's got experience that she can talk to others about. And again, some of our membership activity may just simply be around actually helping people with more information about, mental health, learning disabilities, and so on. There's so much that there's so much experience that we've got on our council, and it's how do we harness that to actually help to increase people's understanding, really. So it's really a nod to Susan and such a recognition that what we're thinking, Susan, in terms of what we'd like to do around membership is actually using some of the expertise that we've got in our governor group as well. Thank you.
Thanks, Fiona. So there's some practical tasks that we need to look at in terms of governance. We need to look at the lead governor and deputy lead governor roles, update the role description, hold elections. We need to recruit to vacant posts on the nominations and remuneration committee, which again is the one formal group we are required statutorily to hold, fill remaining governor seats, finalise meetings and work plan, and agendas and activity focused on statutory duties together, as I've said, being the best we can be, and to ensure that voices from all corners of the council are heard as we work together to respond effectively to the challenges we face, not just as a nation, but as a society and our local community. So I think I've just run over a little bit, forgive me. Can we go on to the questions, please? I think we've got now. So yeah, we've got 3 questions here. Just for consideration, should we vary the times of the council or governor meetings? Should we set up a workshop to explore our training and development needs? And do we have a membership and representation group? The second bullet point, on a personal level, I would fully endorse that we do need to come together as a new council to think through what do we need in order to fulfil our role. Not just looking towards the board, but also to represent members in the community. And that would be also an opportunity to think about, do we need a governor member's office? Do we need a social media presence? Do we need an editorial panel? And how we can build on the strength of the council at this stage of its development. Thank you. I'll hand you back now to you, Fiona.
Great, thank you. So I just wondered, in terms of where we are in the agenda, Krishni, would we have a moment to just actually take some feedback on some of those questions, please?
Yes, I think we can, and particularly on things like the times of the council, because I'm very conscious that what we learned from the induction is quite a lot of our new colleagues on the council are working people, so we just need to be mindful of that. So yes, by all means, Fiona, if we can take perhaps just 5 minutes or so, I think that would be great. And I do want to pick up the point that Chelsea has made, which I still think is something we've acknowledged before, but she has highlighted again that she would like to see another younger governor position, which I know is something that we've talked about, and I think we have an opportunity to look at. So thank you, Chelsea, for bringing that up. I'm conscious that we haven't yet addressed that, but it is something we have focused on and should take forward. Back to you then, Fiona, to manage that.
Great, thank you. I just wonder if it would be better if we I can remind us of the 3 questions as can Chris. So should we just all be able to see each other? I just wonder if we stop sharing for a moment, because otherwise I'm not sure I'll be able to see all the hands and so on. So in terms of the times of our council of governor meetings, we have had some feedback from some new governors saying that in actual fact they've got other commitments during the day. So we did wonder, at the moment, we tend to run the meetings 10 till 1, but should we be looking at a different time of the day? I mean, can we have either hands up, or I can see Susan Bruce and somebody else is wanting to come in. So if we go for Susan first, and then I'll find out who the other person is. Susan, please.
Hi, yeah, I work Monday to Thursday at St Andrews, so a Friday or in the afternoon would be best for me. I've had to take the day off as annual leave today, so that would be great if we could do something about that.
Thank you, Susan. I'm just trying to, I don't know if anybody can help me out. I can see some of the
hands. So Fiona, shall I manage that? So
yeah.
I think David wanted to come in.
Thank you. Hello, David Jones. I'm one of the new governors representing Northampton. So this is all a new experience for me. So thank you for the explanations. Timing of meetings, that makes a lot of sense to think about holding some meetings during the day and some meetings in the early evening, perhaps. I would be quite happy about that. The communication with the constituency, if you like, it does seem to me something important. But I'd just like to make a general comment. I've been involved in loads of board meetings during the pandemic for other organisations that I'm involved with. I'm a professional social worker by background, now retired, but there are lots of meetings, and I think they work incredibly well for taking forward business and progressing things and involving more people. They are not so good when you've got a big conflict and when you need people to actually be able to be together. Of course, anything is possible, but I think the opportunity for avoiding conflict by informal discussion is really quite important. And I don't quite know how we do this. I like your idea of coffee mornings. That seems to me to be good. But I think we have to be aware that we have had a limited experience, even over a year. Everybody's committed to making it work. But where there are difficult issues to explore, sometimes we need to meet in a way which enables us to be able to make personal connection. I'm just learning and understanding this. It's all new for all of us, but I think that we need to be alert to that as an issue. But meeting at different times, training opportunities, these things are good. But remember that many of us have got other things we're linked in with as well. So time is an issue. Thank you very much.
Thanks, David. So I think there's a sort of desire for both formal and informal interaction, and I think that's a really important point. Can I suggest, if anyone's got any personal views about timings of meetings, that you put that in chat in the interest of time, and then we can pick that up. But I think the general feel I seem to be getting is that actually people would like some flexibility, and maybe kind of thinking about, alternating might be helpful, so that it kind of meets different people's needs. Helen, did you want to come in on a separate point?
Yes, I didn't want to talk about timings.
Great, go ahead.
Just for a change. I'm very much in favour of addressing, looking at our training needs overall. I think the step before that is something that it's not within this presentation, but I did want to just mention it, is that the pandemic obviously forced us to change the way we were working. I came in at the start of it, so I haven't experienced anything different, but it's been probably the most difficult thing has been visibility of actual activity within the trust has been the hardest for governors to get their experience of and view of, and I don't think we've addressed that yet. I think that's still hanging out there as something that we haven't actually got to the bottom of. How do we effectively allow governors access to the activities of the trust to be able to feel assured by what we hear in the meetings? And that's still lacking for me. But it's related to, how do we know what we need training on if we actually don't know what we're looking at? So that would be what I would want to just pop my 2 pence in on. Thanks,
Helen. It's a really good point. And of course, at the moment, none of us, including myself or any of the non-executives, are able to do any service visits because actually it's not safe to do so. So whilst we're still in a pandemic situation, we've obviously been very careful about that. But I think we do need to think about that kind of as time goes on and we feel more confident about it, under advisement, because we would have to take the view from Julie Shepherd and other executive director colleagues about the safety aspects of that. But I don't think any of us have been able to do any service visits now for probably 8 months or more. And even then it was only very brief. So I think that's something we'll need to think about. And obviously, ultimately, face-to-face meetings and other opportunities that might arise from that, which we, conferences, if we were having staff conferences, we would normally invite governors to those sorts of events as well. So you have the opportunity to get a feel for the what's actually going on in the trust on a more a sort of day-to-day basis, if you like. So those are things we can start building back in, but it is a challenge. I think it remains a challenge at the moment. Thank you, Helen. I'm conscious of time, so I think we probably need to move on. Scott, I know you said you'd like to come in. I think you asked in the chat whether it was something that was limited to contributions from governors. Did you want to make a comment?
No, I was just trying to clarify what the expectation was, Christy. That was all. I didn't have a particular point. So no, I'm happy to see then. I noticed that Vida's got her hand up. So if you had any more time, I'd give it up to her.
Okay. Vida?
Thank you. Thank you very much, Chris. I found that really interesting, and I fully support the approach I think is being taken. As you know, one of my concerns was around, how do we engage members? And I've spent some time looking at the NHS providers website, and you can pick up from best practice the way they have developed their members database, how they use that to actually help the governors really engage, not just with members themselves, but with the wider public, because we are only few and they are many. So I fully support both points, actually. Thank you.
Thanks, Vida. That's really helpful. So it's a lot of really good points. Great to see so much chat going on in the chat area, and I think all of those things we will look at and pick up and make sure we're covering off. I think what strikes me is that the sort of detail of some of this needs really to be looked at by this membership and representation group. The council is a sort of formal structure that helps us particularly focus on things that need decisions, I think, particularly from the council, and there are lots of things we will need to manage in that way. But some of these other things around how we represent, the points that Vida's made, etc., and also visibility, even that Helen talked about. I think all these things are things that we can perhaps pick up in richer conversations we can have in sort of slightly more less constrained formal environment. So we will certainly pick those points up. Fiona, is there anything else you wanted to finish off with before we move on to other matters?
No, let's move on to other matters. I think, again, I'd like to thank everybody for that really rich discussion. We'll be looking at the chat very carefully, but I think we are sort of agreed that we will vary the times of meetings. We'll look into that. We'll do something, probably a workshop based item to look at training and development, and we will actually start to formally look at setting up this membership and representation group, because I think there's quite a lot of interest in that. So thank you.
Brilliant. Thanks, Fiona, and thank you very much. So that brings to a close item 7 and some actions that we're going to take forward as a result of that. We've got still 3 more items in this section on council matters, and some of these are, I think one in particular, we need your approval. So that's the next item, item 8. And then we've got 2 update items. So back to Fiona for the constitutional matter. Fiona?
Okay, thank you. In fact, I was going to actually ask Richard to do this, because I have probably done more talking than I need to, and it's a good opportunity to just actually familiarise new faces and voices with the council. So, Richard, I wonder if you could take this one for us, please.
Certainly, thanks, Fiona, and good morning, everybody. So I'm Richard Smith. I work for Fiona in the corporate affairs team, and I'm head of corporate governance. So constitutional matters, it possibly sounds a bit of a boring topic, but it is actually a really important one. So if I could draw your attention to paper E in the pack, which sets out some key things that we wanted to bring to your attention. Within this item, we are then just seeking your I guess, approval really to the proposed changes that we're looking to make to the NHFT constitution. I'll explain a little bit more about what the constitution is in a moment, and essentially endorse the proposal that we alluded to earlier regarding the recruitment process for some of the vacant governor seats that Tracy outlined earlier on. So in terms of the constitution, then the constitution is really the key document for foundation trusts across the country. So we have one. All other NHS Foundation trusts have one, and it sets out some of the key features of how the system of governance works within NHFT, so how we make decisions, the roles and responsibilities of individuals, and within the Constitution is the standing orders for how the Council of Governors work. So if you are interested in learning more about how some of the technical aspects of the meetings work, do have a look at the Constitution, which is available on our website, and we can send a link out to those of you that haven't yet had a chance to look at it. So within the Constitution, we set out the way in which the communities that we serve as an organisation are represented in terms of governor roles on the Council of Governors. And as you can see here on the first page of paper E, we need to think about what the change in the local authorities in Northamptonshire means in terms of the representation of local authorities on our council. So I'm sure everybody probably is familiar with the change, but just in headline terms, so we've recently moved from a position where we had Northamptonshire County Council and 7 district and borough councils for our local area, to a situation in which we have 2 unitary councils, so one in West Northamptonshire covering what was Daventry, South Northants and Northampton borough councils, and one for North Northants, which covers all of the other district and borough councils, so Kettering, Corby, Wellingborough and East Northants. So as a consequence of this, we do need to update our constitution to reflect the new council authorities. So quite simply, what we're proposing to do is to move from what we had before, which was one county council representative and one district and borough council representative, to having essentially one representative from West Northamptonshire council area and one from the north. So hopefully that logically makes sense. Of course, we will need to think about who the councils would want to represent their organisations on our council going forward, subject to that proposal being, of course, approved by the council. So that was the first aspect of this paper. The second aspect then relates to the vacant seats. So we heard earlier on from Tracy that we have a number of vacant seats on the council, which clearly we'd like to fill. So on page 2 of the report, you can see those seats again listed out. So in short, what we're proposing to do as per our constitution is for those seats where we don't have a second person in line to go back out to a competitive elections process, as many of you that are new governors will have just experienced. For those seats where we do actually have somebody that competed for the post but wasn't the first preferred candidate, we have provision within our constitution to offer up that seat in the first instance to those individuals should they wish to take them up. So it's essentially we're proposing to avail ourselves of that option for the seats where that would apply. So in short, really, we're putting two proposals to the council. One, the constitutional change to change the local authority representatives to a West and a North Northamptonshire Council representative, and then secondly we're proposing to initiate the elections process as I've described. So there's a little bit more detail in the paper, so for those that want to look at the specific wording we're proposing, I draw your attention to Appendix 1, which again, subject to the council agreeing it, would then be the wording that would feature in our constitution going forward. What is worth also noting, again a slightly nerdy governance point, apologies, but in order to approve changes to our constitution, we not only need the council's agreement, but we'd also need to put the proposal to the NHFT Board of Directors, who would also need to approve it before any such change came into being. So hopefully that all makes sense, and I'll happily take any questions and really put those proposals to you. Thank you, Krishni.
Thank you, Richard. Oh. Sorry, slight delay on me unmuting myself there. Thank you, Richard. So clearly, I mean, I would say this is a necessary change rather than an optional change, because it's a matter of fact that the unitary authorities have changed. And therefore, it does need to be reflected in our constitution. So it is something we need to do. But I can see that Rosie would like to come in, and Rosie is actually one of our representatives, certainly from the council point of view previously. So Rosie, congratulations on your re-election.
Thank you.
And yes, over to you.
Well, obviously, you know, it's just housekeeping, really. It's just bringing everything into lines in terms of the West and the North appointments. I just wondered whether there was a reasoning in terms of the public constituencies. You could say that you had 6 from the West and 6 from the North, rather than highlighting Kettering and Corby and Northampton separately. And I just wondered whether that had been considered, or whether there's you know, part of your reasoning for keeping everything as it is.
It's a useful point of feedback, probably one in which we need to look at, Richard and Fiona. I think just to, because I think it's these are all technical matters, really, aren't they? So it's making sure it's accurately represented.
Yeah, I mean, we obviously have to run our public constituencies along electoral wards. So we'll take that away, double check it, Rosie. But thank you for raising that.
Excellent, thank you. So if everyone's content, we would like, David, did you want to come in?
Yes, just a small point about this. One of the I don't know how much the public are really interested in what has changed, but one of the big issues is about locality of representation. And I think I would say, I take Rose's point about these are the new authorities, but I think we have to demonstrate to people throughout the system that their local needs and their local circumstances are important. And that's particularly important when we're dealing with community mental health services. So I think that there is a very strong argument for saying that it is worth making sure that we do have people from all of the different areas, and these are big areas already, but that we make sure that we do have somebody who's living in and involved in these different areas. As a Northampton resident, if all of the West Northamptonshire people came from outside of Northampton town, I think that would be a problem. So I know this is part of the debate about what these changes mean, but I think the way that you've designed it does make sense. And I think it, provided they're fixed around wards, then that's worth keeping. Thank you.
Thanks, David. So just to be absolutely clear, the elected seats as standard will always represent the electoral wards. That's a statutory requirement, so that isn't going to change. What we are focusing on here is that we've always had representation from our local authority for obvious reasons, because it makes sense to be well connected as partners with our local authority. So the partner governors we have 2 partner governor seats available to our local authority representation, and they are nominated by the relevant local authority. So that's the technical change that we're making here. So if everyone's content to approve that, because it does need to be approved for us to take it forward to council, we will just check to make sure we've technically represented it correctly. So thank you, Rosie, for that comment. And then we shall take it forward to the board for approval, if that's okay. Is everyone content with that? Great, thank you. And also, of course, the other point that Richard was making about elections was to move forward at an appropriate point. I mean, it won't be immediately, but certainly within the next week or 2, we'll be looking at starting an election process for the outstanding seats. And I would say, whilst I have a moment to do this, because we're talking about vacancies, I think it is important to say we did recognise that a number of people were standing down at the last council, and we did thank them for their enormous contribution. I do want to say again that probably actually there has been a few changes since then, with some long-standing governors also stepping down. So it is important to say, all our governors make an enormously positive contribution, and we need to recognise the contribution they've made. So the thanks continue to go to all those who've worked with us on our Council of Governors and have since moved on. So thank you very much. We move on then to items 9 and 10, which are updates really relating to our Nominations and Remuneration Committee. I believe Carol is leading on these. Carol is our acting chair for Nominations and Remuneration Committee. So item 9 first, Carol, which is the update on chair and non-executive director appraisals.
Thank you, Krishni. And good morning, everyone. I'm Carol Phillips. I'm a public governor for Daventry and South Northants, and I'm in my second 3 years. I've just started my second 3 years as a governor.
Congratulations on your re-election.
Thank you. And I think you have an updated version that was sent out, Richard or Tracy, yesterday or this morning. Yeah.
Do you want us to display that, Carol? Would that be helpful?
Yeah, that's lovely. Yeah, I've got it. Yeah, it's lovely. Yeah. Thank you. Yeah,
let's do that. We'll do that now.
Share. Okay. So one of the functions of the Nominations and Remuneration Committee, which I'm now going to call NOM-REM, because I can't say that too many times, is to act on behalf of the Council of Governors to lead the process for the chair and NED appraisals. Next slide, please. There we go. So this is a 360 really, and we NomRem take control of this and then report it back to the Council of Governors, giving them assurance that this process has been undertaken and completed when completed. So as you see, feedback is sought from governors, board members and stakeholders via a survey, and the governor survey has now been completed. I'll come back to the completions in a minute. So the self-assessment has to be completed by the chair or the non-exec, and then the appraisals are undertaken by the chair's appraisal panel for the chair and by the chair for the non-execs. And we, as NomRem, then report to the Council of Governors. Next slide, please. So this is where we are, and this is where the so the survey, as I said, the governor survey was closed on the 3rd of May, and we've had 16 responses for the chair appraisal. I'm not sure why it's 11 or 12, but 11 to 12 for the NED appraisals. Fiona, do we know if this is up on last year or not?
As I understand it, we've had more feedback from governors this year than we have had in previous years. The board members that we opened that survey a little bit later, we're still waiting for a bit of feedback there. But no, certainly more governor input, and that's been very much welcomed.
Okay. Well, thank you for all governors who were on this call who completed the survey, and for those who left but completed the survey. So then we go into a survey by the board, and that was launched and now is closing on the 18th. We've identified stakeholders, and the feedback from the stakeholders is due on the 31st of May. Self-assessments, appraisal meeting and appraisal reviewed by NomRem, and obviously the report to the Council of Governors are not yet due, but plans are in place. So this is to bring to the Council of Governors assurance that this process is on track as planned, to be reported to the Council of Governors in July. I'll take questions. No?
Thank you, Carol. So is everyone okay with that? I think just to mention that, yeah, we also, the other step is we need to report all of the outcomes of that now to our regulator as well, which is an additional step. But really good work on behalf of NomRem to kind of keep an oversight of this process and make sure that it's followed through appropriately. Fiona?
Just on that, Krishni, I just wanted to just remind us of the deadline for submitting some of this information to our regulator, unfortunately, doesn't tie in neatly with our Council of Governors, the dates that we've got for our Council of Governor meetings. So we may need to, we just need to address that and make sure that we cover that sort of appropriately, but we'll certainly have a NomRem meeting to finalise, and then we'll probably need to submit and then advise the council that we've done what we've done. So just a small point. I see Rosie's got her hand up.
Rosie?
Just a comment that the using Evaluate was very easy to use, and you know, made the whole process very straightforward. However, and Tracy will know this, I only found mine by accident, the junk file. So it might just be worth reminding, because it was coming from an unknown source, it just went straight into junk. So when you rerun it next year, it might be worth sending out an email to everybody saying they've gone out. Just if you haven't received it, please check. Thanks,
Rosie.
It was just a point.
Thanks, Rosie. A helpful, practical point, and these things are important because it's otherwise easily missed. Just to make sure that everybody knows, I mean, clearly new governors weren't asked for feedback, so this feedback was from anybody who was in place up until the 23rd of April or whatever. So people who were existing governors who've stepped down did have the opportunity, you know, who'd worked with us obviously for some period of time, actually had the opportunity to provide that feedback. Clearly, as new governors, those colleagues who've joined us just recently, you will have the opportunity to do this next year in a year's time, but you won't have been asked on this occasion. So that's great. Thank you very much, Carol. So the final item before we go to a short break is the annual report of the COG nominations, NOMREM. So this is a report from NOMREM outlining its activities for last year. So back to Carol, please.
Okay, this is, I'm going to assume that everybody's read the paper, and so I'm not going to talk my way through it, but just to say that NOMREM have been carrying on more or less as normal throughout the pandemic, and had regular meetings. And we've just talked about one stream of work, which is obviously the appraisals. The other stream of work is around reappointments, and we'll be bringing suggestions for reappointments and appointments to the private meeting. But just to outline the sort of activity that's been carried out by NOMREM during this last year. So happy to take comments. Anybody from I'm not sure there's anybody from NOMREM actually. Oh, Helen's here. Is Alec here? Yeah.
Alec's also here.
Yeah. Okay, Fiona, you've got your hand up.
I was just going to say, it might be worth just mentioning, Carol, that the NOMREM have kindly seen this and commented on this report already. Yes. And again, yes, just as we did with on item 6, this is an item that we've used, and we've used some of this information that for our annual report and accounts, because we're required to report on our nomination and remuneration committees. So just wanted to make that additional point.
Okay, thanks, Fiona.
I think Rosie wanted to come in, Carol. Rosie?
Yeah. Rosie, you have a question?
No, it was accidental.
Sorry. Accidental. No worries, no problem at all. And actually, just to be clear, with new colleagues, especially, NOMREM undertakes some of the most sort of critical sort of activities, really, that are statutorily a part of the governor's duties, which include, you know, appointment, particularly of non-executive directors. So what you will have in the private meeting that follows is another report from NOMREM, actually with some recommendations. So that is there's often going to be reports from NOMREM asking for approvals of things. And what you have in that helpful annual report is really a summary of the activities that were undertaken last year. But you will regularly be asked to approve things that NOMREM has looked at and wants to report back on, and particularly as we've highlighted, the appointment of non-executive directors and the sort of overall appraisal process, etc. So let me just check if there are any other questions.
I think Helen.
Helen.
Yeah, just a very, very brief one to say thank you very much, Carol, for all your hard work on NOMREM. I had the pleasure of being able to sit on the committee for a few months, and I would recommend to everybody always read the NOMREM reports when they come through COG, because buried in a lot of constitutional requirements is also our assurance that we're doing all of the planning to make sure that we are appointing people in good time and maintaining a good level of oversight on how we're actually running the appointments and oversight of the board appointments. So honestly, I would highly recommend always read the NOMREM reports. They are always worth it.
Thanks, Helen. What a recommendation. That's fantastic. And thank you so much, Helen, for your contribution. Helen only stepped down because she had other commitments that have arisen that meant perhaps she wouldn't quite have the time for non-rem. But you will all, hopefully that great recommendation from Helen will interest you all in putting yourselves forward for standing for our non-rem committee. It is one, as we've already said, undertakes statutory duties, and it has a limited membership by design because it has a very specific number of people present on it. But it is a really interesting committee to contribute to. For all the reasons that Helen said, and thanks for Carol for stepping in and being acting chair as well, which has been brilliant. So if there are no other points, I think that was just for you to sort of receive that and be aware of what was actually going forward to be as an annual report on non-REMS activities. So if there are no other comments or questions about that, I suggest we go for a well-earned break. I'm sure everyone's gasping for a cup of coffee or a cup of tea. And when we come back, we're going to move on to session 2. And I'll be welcoming Angela Hillary, our Chief Executive, joined us a short while ago, but she slipped in quietly from the meeting that I mentioned she was attending. So I will do a small introduction and then hand over to Angela when we come back. So if we could all be back here in about 10 minutes, that would be great. So 25 past, that would be super if we could at least be back on screen, and then we can be ready to go a few minutes later. So see you shortly.
Yes, thank you, Krishna. Before we get into the next session, taking Carol's lead, it just reminded me that I ought to explain as well that I am a public governor for Kettering and Corby. I too am in my second term, having been re-elected, and the trust had asked me to continue as acting lead governor. So I was taking Carol's lead there and just wanted to explain that I also am a public governor as well. Thank you, Krishna.
Thank you, Chris. I think we, helpfully in your case, we had written to the council to let them know that you were continuing helpfully in the acting lead governor role for continuity. But obviously we have said that we will be running elections, so everyone will have the opportunity to consider that again. But thank you, Chris. Helpful for everyone to know what constituency you cover on a day-to-day basis. And congratulations on your re-election as well, which is important to say. So welcome everybody. So we're on to our second session, and this is really the opportunity we're sort of moving on what are the maybe kind of particularly council focused matters, to talk a bit more about broader business issues, if you like, and areas that we want to bring to your attention. So I'm very shortly going to introduce Angela Hillary, who's our Chief Executive, which I know many of you will be seeing or meeting at least virtually for the first time. Before I do, I just want to draw your attention to paper H, which is my report to the Board of Directors, which took place in March. I'm not going to talk through it because some of the information there is fairly historical now, but I do want to mention that the Board of Directors considered the appointment of a senior independent director. Now, this is an important role within the board, and the senior independent director acts as a sort of helpfully, you know, all non-executive directors are expected to be independent, but the senior independent director is there to particularly help with any issues if they arise between the board and the governors, between board members themselves. Also, the senior independent director is expected to lead my appraisal as chair. So it's an important role for one of our non-executive directors to undertake. Moira Ingham, who is present today, Moira has ably done it for quite a long time. But as many of you will know already, those of you who've been governors for a while Moira, after many years of service, will be leaving us in the not too distant future. So we needed to make that change, and the board of directors supported the appointment of Melanie Hall as the new senior independent director. Because actually this was something that it was important for us to consult with governors as well, albeit it is a board decision. We did consult with the Nominations and Remuneration Committee members about that appointment, and also indeed we had a keeping in touch briefing where we discussed that appointment, and colleagues were universally supportive of that. So I really just wanted to share that particular point and make sure everyone's aware that that process had been concluded, and Melanie is now undertaking that role. So congratulations to Melanie, and she did of course send her apologies for not being here with you on that first meeting for many of you. So that's all I wanted to say. If anybody has any questions about anything in my report, they're of course welcome to ask me. But in the absence of that, I'm going to warmly welcome Angela Hillary, our Chief Executive. As I said, I know many of you were, well, some of you will know her as staff governors, many of you will be meeting her for the first time. If you remember from your induction, Angela actually runs the organisation on a day-to-day basis. So she's the very important person for you all to know about. And what she's going to do now is just talk to you about sort of what's on the top of her agenda, so that everyone gets a feel for what's going on in the organisation at the moment. Over to you then, Angela.
Thanks, Krishni, and good morning, everybody. And for those I haven't met before, really good to have you with us. I welcome you to the Trust, and I thank you for wanting to be involved, first and foremost. But what I must say is that, as Krishni's kindly said, that I'm running the organisation, well, I do it with a lot of help. There's a lot of people who help me, so I wouldn't want to convey in any way other than that, because it's about Team NHFT all the way. But yes, so just a couple of things that I think are really important to share with you. And I never want to miss the opportunity to publicly thank our staff as we continue to manage the incident of COVID, which I know we've spoken about a lot here. But whilst the increasing cases are diminishing, we have clearly got a lot of focus in the organisation still on recovery. And that's a lot of work that's going on across the piece, and David Mayer, our Deputy Chief Exec, and Jean, in terms of running the ICC, are still very much centre stage with the team working on recovery, and it is as demanding, as you can imagine, as anything. And part of that is having a series of big conversations, which we are deliberately doing with our staff to understand how we can take things forward together, what we can do differently, what we can change, what we need to retain, and that's proving invaluable. But I know David will share more on that. So the couple of things that I wanted to just mention to the governing body is, of course, we are and have been involved in our operational planning processes, which were a clear expectation upon us. All organisations in the NHS have this requirement, and importantly, we have to do this as a system, not just within the organisation. And the area that I want to focus on is the mental health component of that, because within the expectations is a very clear role for us as an organisation to sign off the plans for the mental health monies. Now, we really welcome that, because that is a national direction, and it's one in which we would support the direction they've taken. But nevertheless, it does give us an opportunity to play a leadership role, as you might expect, in the mental health monies. And I'm really pleased to say that Paul Sheldon, our new Director of Finance, I think is with us this morning, and myself have met with the CCGs, and we have agreed the mental health components and the monies that are coming into the county. And there's 3 tranches of money that are important to flag to governors. There's the mental health investment standard, which is an important element as before. There's what we call SDF funding, and there's spending review money, which you will have seen in national headline terms, of which Northamptonshire gets a share. Now, what I'm really pleased to say is that we have common agreement about that money. We have common agreement about it being ring-fenced for mental health. That doesn't mean it is all of NHFT, because that's not appropriate, but it is ring fence for mental health. And I think that is very, very much a big step for the county, important one to share with you. And I would want to share and thank colleagues who have worked behind the scenes in developing those plans, and also to Paul in terms of working with system finance colleagues to deliver that. Really important. And building on that, we are now, as you hopefully recall, part of a mental health collaborative, which is one of the system's priorities that everybody's recognised. And I'm chairing that collaborative. It is a programme of work that is building upon great work that's already been led through individuals like Anne Rackham, our Director of Mental Health Services, and a wide range of partners. And we have some pillars of work that are really bringing agencies together across the long-term plan and other areas. And it is really leading the way, I think, in the system in terms of how we can do things differently. And encouragingly, just to give you an example, whilst we do focus on the long-term plan and the money and what we're doing, we also are taking the opportunity to think about areas that really matter to people that we're perhaps not doing enough of together. And to give you a sense of that, the focus our last session was about housing and accommodation and the opportunity that we can, through system working, make a difference. So really, really encouraged about that. We are continuing, you'll see through the report, to focus on our integrated care system development. That is a requirement, and we are supporting that. Krishni, myself, David Williams as our Director of Strategy, and other directors are very much immersed in system working, but we do need to design the new format for it, because there will be, as we know, increasingly statutory obligations on integrated care systems. So we're doing that work as we speak, and I'm pleased to say that David Williams, our Director of Strategy, is part of the steering group that's supporting that, and there is regular debate amongst chief execs and executive colleagues on that development. But that is really important, and I know as governors you'll want to hear more about that in due course. Other aspects I just wanted to build on, you'll see in the report that we've mentioned our lead provider role in the East Midlands around our CAMS collaborative. Very important piece of development, not least for the region, but for us, because we are stepping up into a space of leading across the East Midlands. That brings with it responsibility and accountability, and it gives us that ability to commission as well as provide services. And I'm really encouraged to share with you that there has been a recent development of an increase in funding for that collaborative of in the order of 4 million a year that we've been able to secure. And I'm just going to ask David Williams, I'm sure he's with us, just to share a little bit about how we can use that money and the benefits it could bring. So David, if you're there, if you can just touch on that, please.
Lovely, thank you, Angela. And just for those that I haven't met before, as Angela said earlier, David Williams, I'm Director of Strategy and Business Development here. So absolutely really good news that NHS England have identified us as a provider collaborative that they're willing to invest additional resource in. So it's an extra £4 million a year over the next 3 years for the East Midlands. And I think, first of all, I wanted to start with going, I think that probably is a really strong recognition of how they valued the lead provider work and the way the providers in the East Midlands have come together to work together to solve long-term problems. And I think CAMS, so the Child Adolescent Mental Health Services, the inpatient element of that pathway is the pathway that we're the lead provider for. And there's a real recognition in the East Midlands that we want to make that work more efficiently, but actually what we want to do is to invest in preventing people coming in and needing admission into an inpatient. Because if we can keep people in their local area with the support they're needed, with their family wrapped around them, services supporting them, that enables people to continue to live a life independently and working things through. When they come into an inpatient unit, you're disrupting all of that, which makes a difference for how people then are supported when they come back out of the inpatient unit. So all of this, I think, is a really, really good opportunity. What we'll be doing then is looking at the fact that sometimes admissions into inpatient units happen because there is no other community solution left. You run out of options, so therefore you have to admit. And what we're looking at doing is saying, how can we add in intensive home treatment support, ways of really putting additional support into people in their local community for a period of time that prevents that admission. And I'd just say that I think this is a really important piece of work, but I think it's increasing in the importance. COVID-19 has really made everybody have a look at well-being and how things are, and actually we are expecting that children and young people's mental health needs will increase in demand. So this is a really good investment in taking stuff forward. So we're going to roll that out over the coming years. We've got plans to take stuff in place to get that all developed, agreed with clinicians and other organisations. And so the 4 million will roll out across the East Midlands each year for the next 3 years. Some of that benefit will be for Northamptonshire.
Excellent. Thanks, David. As you say, hot off the press, but so important, and real recognition. And then just another couple of other things I just wanted to mention. As I say, we've just been opening up the Staff Networks event. I cannot say how brilliant they are. They really, really are. And I'm lucky enough to be able to share that with them today. I think they know it, I feel it, but I think it was just so important to say it today. They are so powerful in giving us Healthy Challenge, the voice and the safety that we're creating for our staff to share their stories of lived experience. So invaluable, and they're getting some time out today to do some development, but they really are amazing, and they ooze leadership, is what I've told them today. And then just to say, we've also met with CQC this morning. So Julie and I have been in that discussion, and I think useful just to share with people, those who know already, but for those who've joined new, CQC obviously were not routinely inspecting during the COVID period other than on a risk basis, and they did undertake a transitionary regulatory evidence gathering of all organisations during that period to determine regulatory action. They did that for us as well, and it came out with no regulatory action, which is really important, and we had no risk-based inspections. But importantly this morning, and what I wanted to share was that we were talking a lot about the recovery and the conversations with staff, and they're continuing to do focus groups in the organisation, and they fed back to us that while staff clearly have challenges, are tired and all the rest of it, what they see in this organisation is staff always flipping it to the positive with hope and opportunity. And really, they said every time, without exception, that's what they see. So I just wanted to share that with you because that energised me this morning. I'm sure important for us all to hear. And then a final note in terms of good news is, again, some of you may know, but Julie Shepherd, our chief nurse, was presented with an award, a national award this week. So we had the Chief Nursing Officer, Ruth May, join us this week to present Julie with that, obviously virtually, Gold Award, which is so well deserved as a recognition of her nursing leadership. And we're really proud of Julie, quite rightly. And it's so important in International Nurses Week and Day this week that that's happened. So I'm sure you'd want to join me in thanking Julie on that. So thank you, Krishni.
Let's give Julie a round of applause because that is, you know, it's a great recognition to get. I think I can sort of great for Julie and great for the organisation. I think to sort of for our chief nurse to be recognised for the work that she's done, and I'm sure Julie would say she's got a team around her that help her to do that just as much as Angela said. But it's lovely and really fantastic that happened. So I'm conscious that there was quite a lot there for people and to take on, and for some colleagues might find some of the you know, some of the kind of new terminology unfamiliar, and I think we can think about whether we run some perhaps a session on things like the integrated care particularly, and what that actually is beginning to look like and what that might mean on the ground. Others, all of that will be fairly familiar stuff, but it's all important developments for the organisation and strategically how we're going to be working with our partners, and obviously, you know, the transparency and clarity about funding is always going to be really, really important for any NHS organisation, frankly, any organisation working in this space. I think there are some questions, so let me just have a look at who wanted to raise things. So firstly, I think Susan wanted to come in. Susan?
Hi,
Hi, Susan.
I'm Susan, peer support worker, newly governor. I just wanted to pick up on what David Williams was saying. I think it all sounds great, but one of my main reasons for me joining the governors, is basically what David was saying, to change, you know, and to improve the system. When I moved to Northampton, I was in a completely different place to what I'm in now. And I think the main priority is to keeping people out of hospital is where we place them. I think that's the most important thing, because otherwise they're going to end up back in hospital. If their home life, although it's good, you know, caring for them at home, if that home environment is no good, it's like that vicious circle, and that they're going to end up back in hospital, and in the long run it's going to cost more money. So I think the problem with that is, I think we need to sort of educate people more, and I always say that education's the key. That's what helped me in my recovery. But I come from a background of being in the care system and unsettled family and stuff, you know, and it's hard. But when you're being put in a place that isn't a settled environment, it becomes even harder. And I think that issue needs to be looked at quite a lot. I just wanted to raise that, really.
Yeah, thank you, Susan. And I think that probably links really well to the point that Angela made at the beginning about the importance of things like housing, employment, you know, the quality of people's mental health and the experience that people have is so much more than just the care, isn't it, that we provide. And I think that links well to that point, and is an important part of what we're going to be focusing on going forward. I don't know, Angela, did you want to add anything to that?
I think only to agree with Susan, and thank you for speaking up about it. I mean, I think that's exactly what we need to be focusing more on. And we know that, you know, in other parts of East Midlands, you know, they don't have beds, so they've created different models. So we need to look at all of this, and we need to think about how we support people. You're absolutely right. Couldn't agree more.
Thanks very much, Susan. So we've got a few more questions, and I'm probably going to limit it to those who've got their hands up at the moment, just in the interest of time. But if you do have, so that'll be Rosie, Neil, Chris and Zoe. If anyone else wants to raise any questions, perhaps you could put it in the chat box and we can make sure that we pick that up if we don't have time. But let's pick up Rosie first. So Rosie?
Thank you, and I want to just my point was very much on the same lines as Susan's to David Williams, that what families that I have where I've experienced, we mustn't be totally gung-ho about the family is best, because often it's the family that's the problem. And where you've got a young person in crisis, to be able to get them, maybe not a ward is the best place, but certainly to get them out of the situation, to get people to calm down, and especially where suicide risk is involved. I've known a family where they were having to take it in turns to stay up all night, through the night, to make sure that a young person didn't overdose, and the stress and strains on the family, just to be able to take them out into another environment, to get everybody to calm down, and then bring them back together and support the family and get to the issues that are involved. So we shouldn't be too fast to get rid of any bed-based type environment, but it may not be necessarily a ward type environment that's needed. So I just throw that in just from personal experience. For the sake of the other governors, I can't help but echo what Angela Hillary has said, getting the agreement over the funding from the CCG. over years and years and years, we used to come to governors' meetings having heard announcements by government saying they were putting in so many million into mental health, and then we'd hear the financial statement and we'd say, well, where is this money? Where is it? Somehow the announcements never used to get to the front line. So it's a great step forward, and new governors won't realise how important that step forward is. And the third thing I wanted to mention whilst Angela was here, and I'd raised it last time and you were going to come back to me, was about the Voluntary Services Assembly being set up and whether there was a role or a need for some involvement from NHFT to have a representation on that, because it's evolving, but it should be quite a powerful player in being able to support our communities. So I don't know whether you'd had any further thoughts.
So Rosie, I think you might have missed that. We did talk about that at the beginning of the meeting because it was an action from last time that we recorded.
My computer had updated overnight and then it wouldn't let me do anything. So yeah.
Don't worry, that's absolutely fine. So I think David was working on, David Williams was actually looking at whether somebody would be representing us on that. But also worth mentioning that I know Mark is actively involved in that, and Mark very helpfully has, I think, is leading the carers theme within the VCSC Assembly, and has helpfully invited our carer governors to be involved with that. So I thought that was a really great development from last time that we've been able to take forward. But David, did you want to comment on, have you been able to think about representation on, or have you had to talk to anybody about representation?
Yes, we have been speaking to someone and they've just pulled their microphone down from their ear to their mouth. So I think I'll let them announce themselves.
Thanks, David. So yes, we have been following this up, Rosie, following the meeting, and had some conversations both with those involved in the sort of project management engine of the Assembly as well. I think we're certainly clear NHFT does have a key role to play in supporting the Assembly. That's something we would want to do. We're just in the process at the moment of considering who would be the best person to represent us on there. And I think, as Christian has alluded to, both within the overarching group, but also how we can contribute to the, I think it's 8, isn't it, thematic areas, of which clearly Mark is leading on one. So yes, we should hopefully be able to confirm who it is in future, but certainly a commitment that we do want to be part of that, I think.
Great,
thank you. I'm really pleased. Thank you.
Thanks very much, Rosie, and thanks for bringing that to our attention. Okay, and I do just want to mention, I think it might be, David has sort of put a message in chat about this, but again, for new governors, it might be really helpful for us to send you the link to the range of mental health services that we provide, some of which are not really, you know, they're very much, you know, not on offering alternatives to inpatient care, like our crisis house and crisis cafes that people can walk into, so that there are lots of different vehicles for people to access mental health services, which aren't based on just a choice between an inpatient bed and community mental health services based at home. So, so there's a range of things which we can perhaps send some information to new governors about, and it might be an interesting topic for future conversation as well. Okay, so Neil, Chris and Zoe, I'm probably going to need to ask you to keep it fairly brief, if I may, because we are a little pressed for time. Neil?
This will be super brief. Good morning. I just want to go back to the point that Angela made about the Gold Award to a member of staff. And I think from the reaction on the faces that I could see online, there's huge appreciation and gratitude towards that. I wonder if there's something that we could do at the end of the meeting, just to show that gratitude from the governors to the trust and the staff, so they realise that we really appreciate the work they do, in particular the Gold Award. So I just wondered if we could at the end stop recording, then start again, and just have us all clapping and say congratulations or something really simple like that, which does show that we care, shows that we appreciate the hard work from the governor's side of things, and I'm sure everybody is grateful internally anyway, but just so it comes from us. So that was all I was going to say.
Sorry, I put myself on mute. Thank you so much, Neil. That's really kind of you. We might make Julie cry if we do that, but I will, if we've got the opportunity, we'll absolutely do that at the end and allow that to take place. Chris.
Yeah, thank you. Just actually building on what Neil was saying, I think it would be remiss of us not as a council to acknowledge Julie's fine achievement on behalf of the Trust, due and just recognition for her role and contribution to the life and work of the Trust, not just locally but nationally. So well done, Julie. Thank you. Angela, again, a thank you to you, the exec team and staff for all that you're doing in terms of running the Trust on a day-to-day basis. I think what's coming over through the report is during this transition, it's sort of how do you manage today while create tomorrow? And certainly the ICS development as it moves towards more statutory footing is certainly an issue that we as governors have raised. And particularly we're keen to have a development session, workshop, whatever you would like to call it, around the role of governor in system working, but also the voice of the public and how that will be heard in that sort of governance framework. So just a push for that, if I may, but also just to reinforce the point made earlier about prevention, early intervention and signposting. I think that's where we as governors can help. We have a foot in the Trust, but a foot in the community. And I'm sure, you know, me and other governors can give examples where we've actively done that to promote that prevention, early intervention and signposting agenda. So please use us. Please use us as a resource as you manage that transition. We're here to help. We're here to help you and the Trust. The final point, and I'm sure it will be one less thing for you to worry about, is around the CQC, that they're, you know, not routinely inspecting. I know during COVID, there's no regulatory action outstanding for the Trust. But just to reinforce, and I'm sure I'm correct in this, the drop-in sessions are available to governors as well. And just to really build on a point that Helen made earlier, that during these COVID times, one of our abilities to triangulate what we see at board meetings, what we read in board reports, was to do service visits, to talk and listen to staff. And in that way, we can triangulate and seek assurance as we hold the non-executives to account. And I would encourage governors that where they are available to go to those drop-in sessions, to listen and to look and to learn. And in that way, we can keep in touch with the heartbeat of the organisation, as well as what we see at board level as well. But thank you again, Andrew. It's good to see you on the call. I know you're very busy. Thank you for joining us and for all you and the team are doing on a day-to-day basis. Thanks,
Chris. And I would absolutely say it would be really good to do a session on the ICS, integrated care system for governors. Christy's quite right, and you're right. That would be opportune for new and existing governors, wouldn't it? Because it is moving and we need to be shaping it together. So that's something we need to schedule. I think the importance bit about making sure we've got the public voice is ever important. So again, I think we've got more work to do across the system in that. I wouldn't disagree. So yeah, absolutely. Let's get that sorted and in development, I think. Look to Krishni, she's nodding. Yeah. I think it's one that we would want to do. I think the other thing to say in terms of CQC is they now can routinely inspect. So their period of moving from just a risk base is now into more routine. But what we do anticipate is it won't look quite the same as they've done before. So we probably wouldn't anticipate a comprehensive inspection where we get 110 inspectors joining us. We would get them joining us to inspect some core service lines as part of their routine surveillance of us. So again, we'll hear more about that in due course.
Thank you, Angela. So last comment from Zoe, please.
Hi, can you hear me?
Yes, we can, Zoe.
Yes, Zoe.
Oh, thank you, Krishni. Yeah, sorry for the problem with my tech earlier. Yeah, just following up with just the comment from David, really, about this money in the CAMS, and it's just really interesting. And I'm really pleased to hear about looking for community solutions. and also this idea of like preventing, you know, these inpatient admissions. I'm all over this whole thing about, you know, kind of preventative ways to support people with mental health. And we, you know, and this is my interest area because of my project, and I'll be honest about that, because we do a lot of that work in the community, and we are really excited about the idea of developing a creative and wellbeing community hub. I mean, we see a lot of young people and adults who are going to have mental health issues that could escalate, and we're working with them all the time, and that comes with their additional needs and also just with their general anxieties. And it's about, you know, like this 5 ways to wellbeing, you know, the joint strategic needs assessment priority is to use those 5 ways of wellbeing, and what better way than to have like a hub where you can have people signposted through social prescribing and so on. And I think that like if there's ever a conversation around that, I'd love to be involved because it's interesting to me, and I really hope that the voluntary community, you know, is actually the networks here that we're doing the work are kind of drawn into that, because we're so familiar with that work and doing it all the time, and that will take the pressure off. That's the thinking in any case. So I just wanted to throw that out there as being like a preventative pre-crisis cafe solution, and you know, providing really meaningful, purposeful activity which really helps people's mental health. That's it. Thank you.
Thank you, Zoe. Thank you. I think, you know, it's a important part, Angela, isn't it, of the mental health collaborative going forward, that actually that prevention agenda feeds into it. Yeah.
Yes, it's one of the pillars of work, but I think Zoe's quite right. It's about what can we do in local communities? How do we strengthen and bring together the, you know, the resources, the assets, the people in local communities, not just the crisis intervention, which is so important. So I think Zoe's right, but yes, there's a prevention pillar, which is obviously where we can take some of this thinking, but really welcome your support for it, Zoe, as well. And I'm sure David's clocked the fact, and Jean, if she's still on around, the fact that you're willing to get involved.
Definitely would be willing to. Yeah, thank you.
Thank you so much. I'm really conscious that we need to move on. I'm afraid we've got 2 more items to cover, and we need to get to those because we've still got a private element to get to as well. So can I bring Nikki McLeod in? I think, Nikki, you're just going to give us a brief overview. Nikki's one of our non-executive directors, and I think she's going to give us a brief overview of a risk that was, or a sort of an issue that was considered at our Quality and Governance Committee. And this is a standard sort of item that we do where we bring one of our non-executive directors in to bring you a sense of some of the issues that people are dealing with. So Nikki, over to you.
Thank you very much, Krishni. Hello, everybody, and welcome to the new governors. I'm looking forward to getting to meet you in person. I just wanted to kind of have the opportunity to talk to you about the part of the organisational risk register. Through the Quality and Governance Committee, we have been looking at safeguarding as one of our key risks, so adult safeguarding and children safeguarding. But at the moment, I'm just going to kind of focus on adult safeguarding and just really to kind of run through how we gain assurance that serious incidents are investigated and are thoroughly reviewed, actions taken, and that we learn from those. And then I'll be happy to take any questions at the end. So for serious incidents that occur outside of NHFT, but involving NHFT patients or people that have been involved in our services, there is a large multi-agency review panel, and they undertake safeguarding reviews, and Rose Lovelock, who is our Assistant Director of Safeguarding and Quality, who, by the way, is on the call and is doing the next topic. Rose sits on that multi-agency review committee, and she also attends the Quality and Governance Committee. So we get that kind of two-way feedback. But if we are involved in a serious incident that takes place, then the Northampton Safeguarding Adults Board will meet, and they will come to us and ask for a chronology, and they will scope what NHFT's involvement is within that serious incident or within that person's kind of activity. And then we will declare what our interest is and what involvement we have had with that individual. And then the Safeguarding Adults Board, which is a completely independent board and has an independent chair, they will then collect all of the information from all of the different organisations that have been involved, and will write a report, ask questions, and make recommendations as to learning. And then we would be issued with an action plan, and what evidence would be required to show that we have completed our action plan, and what are the outcomes of the actions. And that's really about improving our services, anything that we could have done better, anything that we can do better for the future. And then all of this information feeds back in through our safeguarding groups, and our safeguarding group is chaired by Julie Shepherd, who's our chief nurse, and our executive director for safeguarding. So there's a real sort of two-way kind of process. And once it comes back into that trust, then the learning is shared through the trust, through our supervisor meetings, safeguarding newsletter, briefing into the Tuesday takeaways. But the important thing is that the learning is shared, and so that incidents that do take place, serious incidents, are thoroughly investigated independently, and then that information can be shared, and learning taken from it. So I think the importance for us, and especially for the non-execs, is seeking assurance that incidents have been thoroughly investigated and looked at, and that there is learning that comes out of it, not only for our trust, but for any of the organisations that are involved, and that we take the information and we act on it, and that we share that information. And there have been, incidents that have involved patients of ours that have been in the community, and have had serious incidents occur, or death, and those are thoroughly investigated and come back through this kind of assurance process. So I just wanted to kind of offer that as how one of the risks that we do highlight safeguarding in the committee really kind of comes through, and we take it seriously, how we approach it and how we learn from the things that come through, really. So Krishni, that was all I was going to say on it, really. If I can answer any questions.
Yeah, thanks very much, Nikki. So I think that was prompted by, I mean, you will see, some publicity around serious case reviews being undertaken, and learning for organisations from that. And really, we thought it was useful for you to hear about how that learning is reviewed and considered carefully, so that changes, if appropriate, that ought to be made are made. I can see that Rosie wants to come in. Rosie?
Yes, hi Nikki. I just wondered, you didn't mention the role maybe of the coroner, and also just to ask, what is the situation over suicides? Do we keep a log of the numbers of suicides, and have they increased during lockdown?
Okay, I can answer the first bit, but I can't answer the second bit. I might have to come back to you on that. The role of the coroner is obviously that they would complete an inquest, and they don't necessarily take place at the same time. So you have the multi-agency review. At the moment, coroner's inquests are way behind due to the pandemic, but serious incident reviews are still taking place regardless of that. there may be further information that would have to feed into it. So the coroner and the inquest review may well take the findings from the multi-agency review into their consideration for learnings, and they can issue they're called Regulation 28, but sort of requests for people to give more information on what they've learned from it and what actions they're going to take. So it's very integral, but the review process is sort of very thorough across multi agencies, but that kind of more formal prospect of the inquest as well. Rosie, is there anything I should have added there?
No, that's. I just wanted to know. When
did you mean Rose?
Sorry, I meant Rose.
Sorry,
yeah.
I'm sorry, Rosie. I think Nikki meant Rose.
I just it was just the relationship really between the court and the coroner, and sometimes they give direction, don't they, or make comments, and so I just wondered how what happened in those instances and how it related to the board and so on. So thank you for explaining that. But I do hope. I know you said you couldn't answer the about the deaths and or suicides and things, but I hope that some sort of log or report to the board that somebody does keep an eye on that.
Yes.
Going forward.
Can I suggest, so we don't lose that point, Rosie, I'm sure, I think there's, if I interject and just say that I don't think there's any evidence that suicides have increased during the pandemic, but we are keeping, obviously all those reports do come in, but I'm sure that Julie or Rose would be able to add a bit more light to that. Rose?
Yes, thank you. Yes, I can add some more light to that actually, because it has been a topic of discussion at the Safeguarding Adults Board. So obviously we have the police report, and the police asked for the coroner's report as well, and it has been an issue that has been requested from the independent chair. The independent chair has been asking us for, as a mental health trust as well, to share information and escalate any concerns we have, in particular during the pandemic. But we haven't seen locally a major increase in those numbers, as you've rightly said. However, we do continue to monitor them, and it is a key feature at our quality and performance subgroup of the board to make sure we keep an eye on those statistics as well, because it's not only understanding the figures, it's looking deeper into the reasons. And has COVID been a contributory factor? Is it the hidden harm? Is it the isolation? What's the cause? What's the root cause of that incident? So,
thank you.
Thank you.
Thanks, Rosie. Hope that helps. I think it's really important to say that I think with all of these things, whether it's a coroner's direction, whether it's a serious case review, the really important thing for our organisation is having a governance process around that says, when that feedback comes or an incident happens, we review what's the learning, and then the assurance needs to be sought that we put that actions in place to address anything that we need to. And because things do happen, things do go wrong, it's making sure that we minimise the risk of those things happening again. And perhaps one of the things we can do in the future is look at how we provide a bit more information about what that governance process looks like, particularly for new governors who'll be less familiar about that. I'm really conscious that we are very behind now, and I can see Susan wants to come in, but Susan, would you mind putting your question in chat? Because we've got one other item that we're going to need to get through, otherwise no one's going to get any lunch. So if I may just move us on to the final item and ask, I think Rose, you're doing a quick presentation to us anyway, aren't you, Rose?
Hello, yes, I am indeed. It's a very short presentation and I will stay as succinct as I can today. So thank you very much, and it's great to be here today to talk to you about and ask for your assistance with nominating the appropriate quality priority that requires audit. I do have a presentation. I will attempt now to share it with you, if that's okay, so I can just talk through the key features. So if you just bear with me one moment. There is a backup plan if this doesn't work, and I'm going to ask for my backup plan, please.
The backup plan usually involves Richard, I think.
Yes,
indeed it does.
Richard here.
Just bear with me a second, Rose, and I'll get the slides.
I've upgraded my system. It's been a bit of a challenge with sharing, so I must have a tutorial at some point, so bear with me.
Okay, so hopefully the slides will emerge in just a moment. Here we are.
We've got them up now, Rose. I can certainly see them.
Fantastic, thank you very much. So as I say, today I'm going to give you a brief overview of the quality account and report, and my ask for you today is a decision on which quality priority we should audit this year. So just to give you a little bit of a background, those of you who have been part of this process before, I apologise, but for those of you who haven't, just to understand, the quality account and report is produced by providers of NHS healthcare services. It contains important information about the quality of the services they deliver. Quality reports are published every year by each NHS healthcare provider and are available to the public. So they look back and they look at the year ahead. As I say, it's a public document and we need to look back, and the look back requires an audit to look at the so what, how effective has that priority been? So the aim of the report is to help patients and carers make informed choices about healthcare providers. It empowers the public to hold providers to account for the quality of their services and engage the leaders of the organisation in their quality improvement agenda. So it is very much a key part of my role, is ensuring that the quality account and report is there and produced, and we are in the process at the moment of putting that report together. So quality priorities, each year we share our quality priorities for the year ahead within the quality account. Our priorities set objectives and measure our work within the three main areas. So we look at patient safety, patient experience and clinical effectiveness. So the reason, again, as I say, we need to audit. So why audit? It's to test the effectiveness and the so what. It is a requirement to audit on our priorities. And today I will present to you a brief summary of two priorities to which I will be asking for a consensus from the group, which of the two the Trust should put forward to audit. We need to bear in mind that the audit does not always just look at the success of the priorities. It's all about the whole process, how it's undertaken, and how the Trust evidence and delivers those priorities. So taking into account the year previous, we may not always achieve, and this year it has been harder to achieve all of our objectives because we've had the pandemic. However, the audit will look at the processes, it will look at how effective we have been and effective to actually gain those processes. So the two priorities, I've tried to keep it very basic and simple for you. So one to consider is the priority around that we set last year, that we will increase 5 of the protective characteristics category baselines by either 10 or 20%. So the improvement difference is around, in disability, is around 10%. The ethnicity is 10%, marital status to 20%, sexual orientation 10%, and belief 10%. This priority was originally chosen because we wanted to ensure that the quality information and data that we collect within our records continue to drive our equality, diversity and inclusion work and improve our patient experience and outcomes. So that's one priority. The second one to consider is following the success achieving our prone restraint objective in 1920, the year we wanted to reduce the numbers of prone restraints used within mental health inpatient services in line with our reduction strategy. So the proposal was to reduce prone restraints by 5% in Q2, 5% in Q3 and 10% in Q4, compared with the number of prone restraints that we recorded in the previous year. Just for your information, and apologies if you know, just to say what a prone restraint is. It's a type of physical restraint used within mental health services. And it's where it involves holding a patient chest down, whether the patient placed themselves in this position is resistive or not, or whether the patient is face down or has their face to the side. So this is then classified and reported as a prone restraint. So, with that very brief overview of the two, I would like, just from what you've heard me saying, I would like a general consensus as to which priority you feel we should go and audit at this time, please, out of the two priorities. So I don't know how we're going to do this. I know that Richard had suggested a hands-up approach. I don't know whether that is able to happen.
Should we start off with Rose, so at least we can see each other a little bit more? That might facilitate. Thanks, Richard. Might facilitate the next stage more effectively for us.
Can we could we number the options and just ask people to put in chat which option they prefer? So can we can somebody put in chat what the two options were with two numbers associated?
I certainly can. Let me just do that for you now. If you just bear with me a second, I'll put them in the chat with a number. So
while we're doing that, Krishni, can I just add to what Rose is saying? So usually the quality account would be audited by our external auditors, but this year we don't have a requirement to do that. We don't need an auditor's opinion. So what we're going to do this year with the governor's audit is that our internal auditors have offered to do this on our behalf, because we thought, being open and transparent, we still wanted to do the governor's audit, even though we're not doing any of the other audits under the usual arrangements. So I just wanted to add that, because I thought this is good practice to do this audit.
Yeah, thanks, Julie. So whilst Richard's just doing that, I can see there are a couple of questions, but they will need to be very quick. So Tracy.
Oh, hi. Hi Rose. I just wondered, what's the alternative to prone restraint if we don't do that? And why is it a negative connotation?
Rose, did you pick that up?
Yes, I did. Yes. There obviously is, but it was more that we're trying to make sure that we just reduce the amount of prone restraints. There is alternative. There is, diversion therapy. There is other things that we can do. But it was recognised through CQC. It originally come from the CQC to look at the number of prone restraints in accordance to the Mental Health Act Code of Practice originally. So that's where it come from. So we set our priority to say we want to be as least restrictive as possible. So obviously using the least restrictive option is not to have that hands-on approach particularly. So obviously following best practice of being least restrictive, that's what we would aim to do, and keep it to as minimum as possible. Hope that kind of answers the question. Thank you.
Is that okay, Tracy? Chris, did you want to ask something else?
Yeah, just if I may, Rose, before I can make an informed decision, and it may be just me, I understand the fact that it's not a requirement for external audit to look at its internal audit, but how were these come and chosen about? Was it, a finger in the air? I'm not suggesting it was, but I need a bit more context, particularly around the first one, which I'm really appeals to me. But when we say protected characteristics, from where to where, what's the narrative behind that? Because I don't feel I can make an informed decision right now. Secondly, if the second proposal is based on an issue that the CQC or whatever regulatory agency said, you're not a problem, but it could be improved, then surely we are required to look at that, because that shows a journey of improving clinical quality and safety. Sorry, Rose, I'm rambling a bit. It may just be me, but I don't quite understand the context and what's driving those two indicators. And if one's particularly around patient safety experience, standards of quality care, driven by an external agency and that we're required to look at, then we would be beholden to do that.
Shall I come in there?
Yes. Sorry, Julie. Yeah. Yes, do go ahead. Yeah.
So Rose wasn't particularly involved in last year's quality account. It was actually Kate Howard, who was my Director of Nursing at the time, as most of you know, Kate. So what it is each year we choose in consultation with staff, and I'm pretty certain it came to governors last year, and service users. So we widely consult across the organisation on the priorities for each year. So we have to choose so many priorities, and within that we always bring two of those to the following year's governors, and say, actually, out of the priorities we had in last year's accounts, which one do you want assurance on that we followed the right systems and processes, and we've been open and transparent in the way we've collected the information, and actually we've managed that priority. So Chris, these are last year's priorities that we chose. Okay. But what we are going to do, because of the pandemic, what we're going to suggest this year is we roll the priorities from last year over, because actually they weren't. During the pandemic, unfortunately, we didn't do everything we said we would do in the quality account, which is fine as long as we put that in the quality account as an organisation. So these are quality indicators from last year, and we're asking you to choose one to be assured that we've actually been open and transparent on the way we're actually measuring ourselves as a trust.
So I think just to add to that, therefore they're both important.
Yes.
They were both priorities. All this is asking you for, this doesn't change the priority one over the other. What it's simply saying is one of these are ones we can do some extra audit work on to gain assurance that we have, done what we said we were going to do, and therefore you get a choice as to where we put that effort. So it's really a preference, not to say that it's that additional assurance, not to say that either of them are more important than the other, because they were both priorities in the first place. Does that help?
Yes, thank you. Thank you.
I think a number of people have responded, so please do carry on doing that if you can, and then we will take that and report back to Rose and Julie that what choices you've come up with. So thank you so much, everyone. I appreciate it. Probably felt like quite a lot for new governors to take on board, and we've still got a private session to go to, which will start very shortly, and we'll need to cover a couple of items there as well. I'm going to suggest that we don't do any other business because I don't think we've got time, and I'm very conscious that I don't want to keep you beyond the 1 o'clock latest finish that we promised. But we did agree that we would give Julie another round of applause to say thank you. Thank you very much. And I don't see any reason why we can't do that in public, actually, as a Council of Governors. So shall we all, if it's all right with you, Neil, to save ourselves sort of stopping the recording and doing that, I just, if everyone's comfortable, well, let's just give Julie another round of applause to say, well done, Julie.
Congratulations.
Thank you, everybody. Thanks.
Okay, now everybody should have received an email saying that for the private meeting there's a separate link. Now the reason for that, just to be absolutely clear, is that because that meeting it does not go out into the public domain. We're going to be talking to you about things that are not public information, if you like. So I suggest that at 12:30, just to give ourselves a few minutes, we should click over to the private link. And when we do that, we've got a couple of items to cover with you. And David Mayer, our Deputy Chief Exec, who I haven't had a chance to introduce, but we will in the next meeting. David will be talking to us about one of those items, and I think the other is Carol is going to lead for us. Is that okay with everybody? So we give ourselves a 3-minute comfort break and switch over to the private link at 12:30, and still aim, if we can, to finish by 1 o'clock so that everyone can have a nice break, because I'm sure we'll be otherwise very worn out. So thank you so much, everyone, for your contributions to the public meeting. Thank you to all the speakers and contributors. We will pick up everything in chat, and obviously this is recorded, so we'll make sure it's all properly minuted and follow up on actions. And I'll see you over in the private link very shortly. Thank you very much.